Good morning, everyone. This is Ray Horodowitz, one of the Prevention System Managers here at DBHR. Welcome to the Behavioral Health Impacts of COVID-19 webinar. We're working through some tech issues and working to make sure our presenters all squared away with audio. So we will start in a couple of minutes. In the meantime, you can look at this lovely instruction slide. But again, hold on and we'll be starting pretty soon.
Okay, hello everybody. My name is Isaac Wolf. I work for the Division of Behavioral Health and Recovery in the prevention section, working mostly with CPWI communities. And I am happy to introduce today Kira Mosseth, who is our, she's a practicing clinical psychologist who splits her professional time between seeing patients at Snohomish Psychology Associates, teaching as a senior instructor at Seattle University, and serving as a co-lead for the Behavioral Health Strike Team for the Washington State Department of Health. Her work and research interests focus on resilience and recovery from trauma, as well as disaster behavioral health. She has worked extensively in Haiti with earthquake survivors, in Jordan with Syrian refugees and Jordanian relief workers, and with first responders and healthcare workers throughout the Puget Sound and the United States. So she's kind of perfectly positioned for our current situation, really. Dr. Mosseth has conducted trainings with organizations and educational groups about disaster preparedness and resilience building within local communities, which is something that we're all very interested in. So on behalf of DBHR, thank you so much for being with us today, Kira, and the floor is yours.
Thank you for having me. I appreciate the opportunity to talk with your group. I'm just checking in terms of time. Would you like me to take about 30 minutes? Is that what I'm planning for?
Yeah, I think that's fine. I mean, we have the hour, so there will be some time for question and answer at the end, but
okay.
But yeah, 30 minutes is fine.
Okay, great. Well, let's jump right in then. So I'm just going to talk really briefly about some definitions so that we're all on the same page with certain things that kind of get thrown around a lot. And then talking about the forecasting work that we're doing at the state level about the behavioral health responses and recovery sort of process for the pandemic, what it's manifesting in our day-to-day work environments and in our lives on a community level, and then what we can do about it. Because I'm a clinician, I appreciate the active sort of, activation of sort of options for what we can do in our daily lives. So burnout, I would like you to consider as being an imbalance of what goes out versus what's coming in terms of emotional energy, physical energy, and mental energy. And it's an exhaustion when it feels like there is not as much coming in as there is going out. And part of that is neurological, which I'm going to explain in just a second. And part of it is just a function of the difficulty of human services work that we engage with. Compassion fatigue is a term that's most commonly used for healthcare providers and sort of crisis intervention and basically public-facing, human interacting kinds of jobs where you just get to the point, based on your own experiences, where you really have a diminished capacity to empathize. You just kind of feel like you can't empathize with other people anymore. And that definitely takes its toll on the work. And then resilience and resilience factors are the two sort of positive protective things that we're going for here, and they can be actively developed and actively worked on, and that's kind of getting out in front of the behavioral health curve that I'm going to be talking about a little bit. So this slide represents a chart of known human responses to disaster and the disaster recovery and response cycle. It was based on a variety of aggregated data sources from events like Hurricane Katrina, the tsunami in Southeast Asia, the Fukushima meltdown, tornadoes, floods, and other sort of smaller critical incidents in the United States, but all kinds of data. And we, not me personally, but SAMHSA has been tracking this, and a lot of disaster science groups have been tracking this kind of thing over time. And we know with a fair degree of certainty that humans respond to disasters in a pretty predictable way. And it's not, I mean, there's no numbers on this, like in terms of the y-axis. There's a general timeline. And we know about when people do better and when they do worse with regard to the impacts of a disaster. And COVID as a pandemic is certainly a disaster. So that's kind of the context that we're all operating in right now. The impact phase was in mid-March of 2020, and then we proceeded into the heroic and honeymoon phases. And that's when, all the memes are really funny on social media, and there's all the toilet paper stuff and Tiger King and all these things that people are sort of, we got this, we'll make it, like we're in this together. And then that was probably late April into potentially towards the end of May, in that window. And then we proceed down into what's called the disillusionment phase. And that's when symptoms become a little bit more influential in people's lives. And the disillusionment phase typically occurs between 6 to 9 months post-impact from any disaster. There's some wiggle room with those numbers, but approximately 6 to 9 months. So here we are in October, and we're 7 months in, and we are pretty squarely in the disillusionment phase for the pandemic. It is characterized by the reality setting in around the limits of assistance. It's when programs and funding tend to run out after an incident has occurred. Again, based on lots of different types of disasters. And it's when people really sort of emotionally and psychologically struggle with the acceptance around what we aren't going to get back. Like, what was life like in 2019 that we might not get back, or might not have the ability to do again in 2020 in quite the same way. And it's really hard. As human beings, we don't like change. That's anybody who works with other people can tell you that, for the most part. Some people do better with it than others, but generally we struggle with change. And it's hard, especially when there are so many unknowns about what's coming next. So the disillusionment phase is a layer. Somebody last week in one of the presentations that I did was referring to it as a trauma lasagna of 2020. And it's all these layers of things in the disillusionment phase that make it particularly hard. So we've got the election coming up, which is a stressor for everyone. We've got, regardless of what political sort of approach or perspective that you have, the election season is very difficult for people in general. And then we also have daylight savings time. We have the weather change. We have the seasonal affective conditions that would normally be happening at this time of year, at this latitude. But it's coincidentally happening at the same time as this disillusionment with the COVID pandemic. We also have the other big unknown, which is what's going to happen with potential another wave of infections in the next few months. It looks like those numbers are going up. They're going up consistently in our country, and we don't know how big it's going to get. And people are concerned, and rightly so. Again, unknowns about how big that's going to get, and then what the social and the economic impacts of that are going to be. The only other thing on this chart that I will point out that I think is very important is that almost everybody, the vast majority of people, return to their baseline level of functioning on a behavioral health level within about 12 to 18 months post-impact from any disaster. Now, the only exception to that is if we get hit by a second wave, and I will talk more about that on a subsequent slide. But the takeaway from this one is that we will get there. The slope with COVID might be a little bit more shallow. It might take a little bit longer because of the nature of a pandemic versus like an earthquake, but we will get there. And resilience is far and away the most common response to disasters. Okay, so these are two potential scenarios for additional pandemic waves. I could say that the graphic designer at DOH got a little carried away with that second one. We think scenario 2 is more likely, but we don't know how big it's going to be. And we, again, no numbers on the y-axis, so there aren't any particular infection numbers associated with this, but we anticipate that, if there is a really big peak in the fall, the behavioral health symptoms that correspond are going to get high and stay high for a while. And that's the result of what's called a disaster or a trauma cascade. So that's going to take a little bit longer for us to get back to baseline. We'll go on to the next slide. I think there's more about this. Okay, so I'm going to come back to the trauma cascade, but I will hit you with the highlights of this forecast. So what we're looking at, what we're anticipating in our state is that around 40% of the population, we've got about 7.5 million people in Washington, and we're looking at about 3 million or so likely to experience clinically significant symptoms within the next 2 to 5 months because of the disillusionment phase, because of the seasonal stuff, and the potential for a second wave. Depression is by far going to be the most common, as well as anxiety. Unlike other disasters, we're not likely to see PTSD in terms of symptoms. So depression and anxiety are the things that we are concerned about and sort of anticipating, and that we can get out in front of by focusing on this development of resilience, again, on a personal level and on a community level. We recognize and have seen in the data that we've collected that substance use always increases post-disaster. It's just that's consistent everywhere in the world for the most part. But most of the people who are using substances as a coping mechanism already, it's going to be exacerbated in the context of a disaster recovery, and not something that we can. I'm sorry, not new incidents of cases. It's more likely to be people that are having substance use as an existing coping mechanism, and they're doing more of it. In July, for example, of 2020, alcohol sales based on tax revenue in Washington state were 80% higher in 2020 than they were in 2019, which is obviously very significant. Yeah, so we're seeing these things across the board. The other concern is for adults over 60. There are some significant data from the Poison Control Center about youth between 18 and 29, or young adults, and then adults over 60 who are having medication errors, and they're doubling up on their dosages of medications and having concerns around that. And we think it's because people are avoiding going to their primary care doctor because they don't want to risk infection, but there turns out to be other consequences from that. So those are some challenges that we're considering right now too. Okay, so this is some of the data that we've been looking at, and you see a gap there in the summer. It was kind of all over the place, but the reason there's a gap is because we didn't have a data technician sort of in that role that was collecting this for us, and then they came back at the beginning of September. So we saw a significant decrease in anxiety and depression over the summer months, which is to be expected. There's going to be ups and downs throughout the cycle on the bigger chart that I showed you. But in the last several weeks, and then the data that I've seen that goes off this chart into the early weeks of October, continues to go to increase. So those numbers are continuing to go back up. And you notice that the trend line goes up. So the disillusionment phase, as I mentioned, can be uncomfortable and challenging. It's when people are confronted with this sort of layers of what we're all dealing with. There's a gap between resources that are available and what people perceive that they need. And for those of us who have been working and trying to manage childcare and all of these, like the juggling act of the pandemic with our responsibilities and obligations, it really has taken its toll. And I'm going to talk about the neurological implications of that, and then also what we can do about it. Next slide, please. So I mentioned the disaster or trauma cascade. So depending on the extent to which the fall wave is significantly high, this is a situation where there are multiple impacts experienced within the same calendar year. And if that happens, depending on, again, the size of this wave that we're starting up the hill for, it would be another impact that would restart that cycle. And the process would be basically the same, but we would likely see an increase in symptoms and then a longer recovery sort of slope. So we'll still get there, but there's going to be kind of layer upon layer. We've seen this in a lot of other disasters. In Haiti in 2010, they had the earthquake in January, a cholera epidemic in April of the same year, and then they had a hurricane in September and significant election violence in November all in 2010. And so every time there was another impact, it sort of reset the cycle. So that's something we're keeping an eye on, but we don't know the extent to which that's going to happen here. Next slide, please. Okay, so the good news, like I've mentioned, is that the long-term response is resilience, and that can be taught, practiced, learned, developed for people across all groups, anyone. And the ingredients of resilience that we are focusing on, the resilience pie, I like my food metaphors, but the ingredients are connection, purpose, and then flexibility and adaptability and hope. Those are the things that we need to focus on to get through this. Okay, so the way that this is manifesting and the reason why resilience building is so important going into these next couple months with disillusionment is that our prefrontal cortex and our limbic system are not connecting and they're not communicating in the way that they normally would. They're not integrated well with each other. If you make a fist with your hand and you think about your brain being a fist, and then you just sort of expand your fingers away from each other, all the pieces are still there, but they're not communicating, they're not connected in the same way. And that's what's going on for all of us. No brains are immune to this. And the way that looks, the way that it shows up in our day-to-day lives is that our limbic system is more influential over our decision-making than it otherwise would be. That means that we are all a little bit more likely to respond emotionally, to respond more impulsively, to be quick to anger or to have a temper. And then because our prefrontal cortex is hanging out but not doing much, at least not the way that it used to, we can't remember anything. We're unorganized. We can't track details. We're having trouble remembering what day of the week it is and focusing. And it feels very distracting and very, it is really challenging, because it's like, gosh, I just can't get done. I can't function. I can't achieve the way that I used to be. And that is a straight up neurological response that is a known feature of being 7 months into a disaster. It's part of what we expect right now. And so we really need to get the word out in terms of community resilience building, letting people know that their brains are stressed out, and our brains are meant to respond to small bursts of cortisol and small bursts of adrenaline, and then recover. And being in a disaster recovery cycle means that we are exposed to long-term, multiple months of buildup of stress, and there are natural consequences for that. So this is something that most people are experiencing right now. Next slide, please. So this is the checklist that you might find familiar, and I really would encourage you to share with the people that you work with, as well as any other members of your friends, family, or community. Being easily distracted, having trouble remembering things, being quick to anger. Those are all just regular occurrences for most people. Having frequent headaches or stomach aches, those are body manifestations of stress and cortisol, and it's something that's super, super common. Having trouble falling or staying asleep. Most people are either having trouble, I hear a lot from people that are lying in bed, like their brains won't turn off, and they just are sitting there like, and they might not be anxious, but they can't get their brain to slow down. Or they're falling asleep without a problem and then waking up at 1 or 2 in the morning and not being able to fall back asleep. So one of the little tips for that is to keep a little notepad, by the side of your bed, and to write down the things that are on your mind. Just scratch them down if it wakes you up at night, and that will give your prefrontal cortex a chance to not have to carry that for you, right? So that you can relieve some of that burden of having to try and remember it while you're wanting to sleep, and it's on that notepad rather than in your head. The carb craving is so real. The joke about is anybody else getting a tan from the light in their refrigerator? And another couple weeks ago, somebody said to me that he was snacking so much that the buttons on his shirt were starting to social distance from each other, which I thought was great. It's so natural right now. And carbs is a normal thing in the fall and winter months around here, but we've been doing it all year. And the reason why most of us have been having issues with carbs and snacking is because they create a chemical precursor for serotonin. They lead to that. And serotonin is that neurotransmitter that makes us feel comfortable and warm and good. So carbohydrate craving is a really natural physiological thing to be happening right now. And it's important to understand why, right? And then feeling disconnected, feeling lonely or sad, even with all of the meetings and the things that we're going through all the time right now. Next slide, please. Okay, our stress brains in the workplace. Like I mentioned, anger, fear, frustration, higher level thinking issues, really having trouble with staying on track and responding to emails. Like if you get an email from somebody, your brain is much more likely to perceive that as threatening than it is to perceive it as neutral or positive. And that's just our natural tendency right now, because we've been under potential threat for so many months that our brains are scanning for that. Like, what's the next thing? Like, what do you have on your pandemic bingo card for November? Like, what's going to happen? And we don't pay attention to the positive stuff, which also increases burnout, because we're attending to threats right now. And that's again, a very known response. Next slide, please. Okay, so this is data about what to do. So we're going to turn the corner and talk about how to develop resilience and what people can do. So if you are, and I don't even want to limit it to supervisors and managers, if you're in a role in your work or regular life outside of work where you have influence over other people based on the opportunity to model for them how to do this stuff and how to build resilience, I strongly recommend that you do so. One of the most crucial takeaways for how to build resilience within a community population is for people to model boundaries, self-care, and sort of these resilience factors in a way that other people can see that it's the walking the walk and not just talking about it. We talk about self-care all the time, right? It's thrown around all the time culturally, but until we start doing it, it's a lot of words. And so getting the opportunity to model for our kids, for our coworkers, for the people that we work with, that these are the priorities, that having boundaries around work time, taking time off when necessary, and being really, really clear on that is important. The other thing, this is data from China and Italy, is that if you don't know what's going on with COVID or what might happen with your team or with your work, say so. Be honest with that. If you don't know, tell your team you don't know. And then active listening. That's probably one of the most undervalued and important influential interventions that people can have. And the reason is because active listening is effective because a problem solving approach, even though we really like that culturally, it actually doesn't help in a disaster. Oftentimes the problems are too big to be approached and be solved. And so having a discussion about problem solving doesn't really make people feel better. But listening to them for the purpose of understanding and caring about their experience actually will. And again, keep in mind that can happen at any level with any relationship, not just the professional ones. So asking those open-ended questions: who, what, where, when, why, and how. In order to reduce burnout generally, we want to focus on those ingredients. We want to remind yourself about what motivates and what gets you out of bed in the morning. We want to focus on boundaries. Saying no to things when they are, things you just can't do is okay, and it should be something that we sort of culturally norm right now. And then focusing on connections. And I'm going to talk a little bit more about some of these in just a second. For the interest of time, I will go quickly. Okay, so resilience is about internal strengths and external resources. I recommend making a list. Write down what has worked for you to get you through the last 7 months and what do you still need. If you put it on paper, it takes your pressure off of your brain to remember all of those things and gets you feeling organized about it. So that is a good thing. And then internal strengths can be developed by changing the size of our goals. So one of the issues right now is that we have the tendency to stick to goals and stick to things that we used to do, like in 2019 and earlier this year. And that's not really helpful anymore because we're not able to meet a lot of those effectively. So changing the size and the scope of your goals will allow you to meet them. And we all need to make adjustments to our expectations about performance and success right now. It's just not possible to achieve in the same way. We can still achieve, we can still do a lot of great good and a lot of good work, but we can't do it in precisely the same way. We need to use different mechanisms to get there. Next slide, please. Okay, so here are your ingredients. This is where the rubber meets the road, kind of. Your purpose. This is about reevaluating what gets you out of bed, right? And what you can do on a day-to-day basis. One of the big problems with resilience in a pandemic is that we get caught up in too big of a picture. And because there are so many unknowns, that feels very overwhelming. So if you are worried or thinking about what to do about the holidays or the new year, like anything like that, I would suggest that that's too far away. That's not the right scope. We need to be focusing on what we need to do this week and today, and maybe by the end of October. And I recognize logistically there are certain work goals that you have to kind of think out about, but in terms of personal purpose for ourselves, we need to adjust our scope and not think too long-term or too big picture. That's where the success is going to be. And then connection can be to anything. Can be to a higher power. It can be to a family member, a friend, a loved one. It can be to a community service organization or a social group, or to a pet. There's been lots of pet adoptions that have really helped people. Humans just aren't meant to be isolated. So anything that we can do to connect ourselves is a really healthy thing right now. And then flexibility and adaptability. That's about doing things and living in ways that you may not ever have considered before and trying it out, seeing how it goes. And then putting new boundaries around that. So, work at weird times if you have to, but then put boundaries around it so that you still have your off time. One of the things I strongly recommend people do is adding a signature line to their email response, which says, I am writing this email at a time that works for my new work hours. I do not expect you to read it or respond to it in those same hours, right? So it's again, modeling the culture of boundaries and of flexibility, which really go hand in glove with each other. They go well together. Next slide, please. Okay, the REST model is about a 4-step process to help reduce compassion fatigue. For those of us as helpers, one of the things that really drives our work is the ability to get what's called compassion rewards. And those are the things that make us feel good about our job. The clients that say, thank you so much, or the feedback from someone that says, I really didn't have that information and I appreciate you sharing that with us. Or whatever it is. But those are the little things that our brains are not paying attention to right now. But remember, our brains are in threat scanning mode. So when someone gives us a compliment, it usually just sort of rolls off and we don't internalize it the way we should. And that increases burnout and compassion fatigue. So rewarding yourself, building in rewards and attending to the rewards that you get from other people. Any positive reinforcement, that is an active thing that we can all do. Establishing boundaries, again, really important. Sharing your concerns. If you have an encounter with a client or someone in the public that you that doesn't go well or that you're concerned by, please share that. Don't keep it to yourself, and try not to internalize those encounters. Right? There's a lot of odd things that are going on in terms of community interactions right now, and it's really difficult not to internalize some of those things, because everybody, remember, is more limbic system driven. And then the last one there is to trust your network. When you have to say no, when you need a break, you have to trust your team. Other people can help, and we can all do that for each other. That's something we can do on a community level to take in the garbage cans for the neighbor or do something. When you have the bandwidth, you reach out and help. And when you don't, you have to trust that someone else can help pick up that slack. Next slide, please. Okay, this is the last one. So take time off if you can. Do things that are not work related. Get outside even when it's raining. Continuing to have outdoor access and outdoor time is really, really helpful. And then passing this word along, right? Getting this modeling thing about how to develop purpose, connection, and flexibility amongst the community members will help us flatten this behavioral health curve. I think the last two slides are resource slides. Yeah, so these are guides that our team has developed through the DOH, and they're all available on the next slide, which has our website link. There's a resilience document that I think is great, and then there's a toolbox for families that I would highly recommend. Next slide, please. All of these things can be found on that top link right there, the DOH forecasts, guidance, and resource link. So everything that's linked on the previous slide is on that first link there. And I think that's it. So if there are questions, I'm happy to take some.
Okay, yeah, thank you so much, Kira. We're gonna actually take a moment to just thank you for being here, and really timely information. It's
Great.
quite reassuring to know that somebody's already thought about all this.
It's not just you, nobody's alone.
Yeah. So it's great. We're going to get to the Q&A portion in a second, but I just wanted to acknowledge it and go ahead and stop the recording now.